The initiative is called the RAT Tracker, the Rapid Antigen Test Tracker. Tell us about it, Ty. What exactly are you collecting and how does this work?
Yeah, so RAT Tracker does exactly that. So parents and kids have been given these rapid antigen tests before the holidays, a kit with 5 separate tests. And yet these tests are not really being reported in any kind of way to form a type of surveillance system that we think they ought to be part of. So we started RAT Tracker on New Year's Day as a volunteer effort for parents and kids to just simply go on to our portal and anonymously report their results.
So we pulled up on a computer sort of what it looks like, and I think it's pretty easy. Is it not just basic questions, a couple of them?
Yeah, just really basic, the date of the test, the age range of the child being tested, whether it's positive or negative, and what school, one of the 800 schools in Toronto that you can select from a drop-down menu and just hit submit, and that's it.
That is simple as can be. And as you say, there's a lot of data there to be mined. 11 million of these rapid test kits went out before the holiday season. Why are you stepping into the breach and collecting this data, Ty?
Well, our publication has been tracking school cases, outbreaks, and closures since the beginning of September as part of an effort to inform parents, students, teachers, policymakers around what's happening within our school system and how to keep kids safe. But as you mentioned just now, the announcement by the government at the end of December that they're going to stop reporting at the school level leaves this giant black hole of information that I think people are quite anxious about knowing. And so this effort is really part of our approach to fill that hole.
When you heard that decision from the government, I wonder what your reaction was. I mean, and what you think of the consequences of not having that type of information at the school level.
Obviously, I think it's concerning that we don't have that level of data and transparency. At the same time, I can understand why that decision might have been made. I think the reality is we have a lab testing system, a PCR system that has maxed out already because Omicron has just spread so quickly. So, and you see lineups, at many sites for that. And so in an effort to really keep that system going and reserve that for example, healthcare workers and others, that having students also relying on that, I think would just crush the whole thing. So I could understand that decision completely. But the fact that we have these 11 million tests out there, as you mentioned, means that these test kits over the 14-day holiday period, these test kits, there's 11 million divided by 14. That's like 800,000 tests per day that could be used compared to just the 80,000 tests within the PCR system. So the RAT system is like 10 times the size, and yet we have no information coming back whatsoever.
So you're collecting it now, and then how do you intend to use the information? What are you going to do with the data for parents?
First of all, we're going to analyze the data like we always do, and hopefully get down to the school level so that you know at the school level what's really happening, if not at the post-school level or at the city level. This is all Toronto-based. But it all depends on whether or not we get the volume of input from citizens. As of yesterday, we had about 2,500 tests reported, and that's still a very small number compared to the number of kids in the school system in Toronto. So we're hoping that the numbers really increase, this week so that we have enough data to actually do that in a meaningful way.
Okay, in a meaningful. I was going to ask the response. So 2,500 in the last 48 hours since you launched this on the 1st of January. And then you will publish it if it is meaningful data. I'm just wondering, kids should have been back in class today. Obviously, this has been pushed back till the 17th of January now at earliest. Do you plan to stretch this out then, or what does that push back in time frame do to your ability to collect data and then publish it?
Yeah, that's a really good question. We're going to try to get as many parents. You having this show, I think, helps us really get the word out and see where we are at the end of the week and do the analysis then. The big issue is that these test kits that were sent home before the holidays, they're going to run out this week, or I think for many parents, they've run out already. So we're going to have to face the consequences of just not having enough supply out there to actually make this happen.